contraindications of tooth extraction. Number one, we will study acute gingival stomatitis. So, what happens in acute gingival stomatitis? That that your gums are inflamed and papilla is also inflamed, and the patient might be edematous. Edema is formed, and the patient feels pain. It is most commonly seen in the children. In this situation, what happens? Your mouth opening becomes very restricted or compromised. So, if there is a carious tooth, so the extraction is delayed in these conditions. Okay. The same goes for the acute pericoronitis. This is actually the around impacted mandibular third molar. So the tooth should not be extracted and removed until the pericoronitis is not treated. You can do non-surgical treatment in this condition. Either you use irrigations and then later on remove the maxillary third molar also. Okay. If to relieve the impingement on the edematous soft tissue overlining the mandibular uh, impaction, means if the patient feels very impingement on that edematous area, so you can use non-surgical treatment, irrigations, and also remove the third molar. Okay, you can give antibiotics, okay, to the patient. But if the mandibular third molar is removed in the face of very severe pericoronitis, means the patient has very severe, not acute. So it can cause a lot of complications. So, so we prefer when pericoronitis is resolved, so you should extract the tooth. Now moving towards the acute maxillary sinusitis. In acute maxillary sinusitis, what happens? In acute maxillary sinusitis, what happened that this is the inflammation of the maxillary sinus, and this is actually above the posterior maxillary teeth like premolars and molars. In this condition, sinus mucosa is swollen, congested with pus and mucus, and the patient feels very painful and tenderness over that area. So basically, maxillary teeth and how sinus is now connected. Okay, so nasal cavity is the medial wall. Okay, you have to visualize nasal cavity is actually a medial wall, and maxillary sinus cavity, which is ear fold, it is the floor of the sinus. Okay, and the roots of maxillary, premolars, and molars are there somehow uh, below the floor of sinus. Okay, now the floor of the maxillary sinus that I have told you lies over close the roots of either first molar, either molars or second premolar. So in some cases what happens, the root tips actually protrude into the sinuses. Okay, so it causes a communication between the oral cavity and sinus. Okay, so in this condition, we do not prefer extraction. It is actually a contraindicated, because if there is actually infected sinus which is already swollen and fragile, okay, so the bone between sinus and tooth is often very thin. It can be destroyed by infection and cause in a and the extraction can tear that very thin floor. So it can cause a communication between oral cavity and your sinus, which is known as oroantrum communication. Can also move to fistula and spread the infection, and it can have also poor healing. Okay, because the patient has already sinusitis, and in this condition you want to extract the tooth, but you have extracted, but the wound healing will be slow because the patient is already having pus edema. So this is a very painful, and this has a very severe post-operative pain. Okay, so you should avoid this. Okay, and one thing I want to tell you, that basically maxillary sinus actually opens into the nasal cavity, into the nasal cavity by a small opening which is known as ostium, that is located in the middle meatus of the nasal cavity. So the best thing to manage such cases, you should have, first of all, you have to dissolve the infection. You have give the antibiotics and decongestants, and you can also give analgesics for the pain. And when the patient infection subsided, so he can come or she can come for the extraction. Okay, so basically that's why we do not refer extraction in these cases. Acute maxillary sinusitis and radiation to the head and neck areas, which I have already told you, it causes osteoradionecrosis post-operatively. When after radiation we cause extraction. After extraction, when you do extraction, what happens? Osteoradionecrosis cause radionecrosis is induced in that specific area. In that, what happened? That the blood supply becomes damaged. There is no blood to the bone, so the when there is no blood, so the healing becomes slow. And in these conditions, patients cannot also maintain her oral hygiene because the due to radiations there is fibrosis, so it causes limited mouth opening. So the plaque control is very hard. The patient, we can, in these conditions, for the management we give actually hyperbaric oxygen. Hyperbaric oxygen is very useful in this condition because it does not give a favorable environment for anaerobics, due to which they will not grow and cause infection. Okay, in hyperbaric oxygen, what happens? It increases the plasma levels of oxygen. It activates the fibroblast, so the fibroblast will form the collagen, the clot, and also activate the osteoblast, so the bone formation should not be delayed, so the healing will be fast. Teeth located within tumor, which I have told you before, whenever a teeth is actually located within a tumor, that should not be removed because it can change the stage of that tumor. The tumor is in malignancy, so it can have further, it can be a very rapidly spread in your blood vessels, in your soft tissues, in your bone.